Hello, my name is Julie Kwan, and I will be talking about amphetamines. So, what are amphetamines? Amphetamine is a central nervous stimulant. It is a group of drugs that increases brain activity, which results in a feeling of higher energy, focus, confidence, and can elicit a rewarding euphoria. Amphetamines can be used legally and illegally depending on the type of amphetamine. Some amphetamines are legally prescribed by physicians to treat conditions such as attention deficit hyperactivity disorder, also known as ADHD, and it can also treat narcolepsy and weight loss. Some common prescription names are Adderall, Ritalin, Focalin, and Vyvanse. And some common street names are Addy, Crank, Speed, Uppers, and there are much more. So what do they look like? And how are they used? Amphetamines come in various shapes, forms, and colors. This includes powder form, tablets, capsules, and crystal form. They can be taken orally, injected, snorted, or smoked. So the effects of amphetamines. There are both short-term and long-term effects associated with amphetamine use. The effects on the body include increased heart rate and blood pressure, high body temperature, loss of muscle control or muscle spasms, sleep disturbances, low appetite, depression and fatigue when not using the drug, dry mouth and jaw clenching, and dilated pupils. And the effects on the brain. Amphetamine causes the brain to release dopamine. Dopamine is a chemical that is involved with mood, thinking, and movement. It can also be called the feel-good brain chemical. This ultimately brings the euphoric event, and many users may feel more energetic and confident when using amphetamine. So the risks of amphetamine use. Amphetamine is a highly addictive substance. It can lead to depression and even suicidal thoughts. It can increase risk of cardiovascular issues. This includes stroke, heart attack, and or heart failure. It can lead to mood swings, which may result to aggression. It can lead to paranoia and or anxiety and cause hallucinations. The long-term consequences of amphetamine use include the destruction of the pleasure receptors in the brain, and it can decrease the ability for the brain to feel pleasure without using the drug. Extreme weight loss results into malnutrition. The tolerance and dependence on amphetamines can increase. It can lead to financial, work, and social problems. It can lead to insomnia and dental problems. So, more information on amphetamine abuse. The use of psychostimulants have skyrocketed over the past 2 decades. Over the past decade, the manufacturing of prescription stimulants have increased by 9 million%. A large public Southeastern Research University conducted a study that reported 34% of 1,811 undergraduate participants have used ADHD stimulants. One reason is that FDA approved an extended version of the drug, like Adderall XR and Focalin XR, which provides longer effects than any other prescription stimulants. Another reason is that there are more diagnoses of ADHD in young adults. So that concludes my discussion about amphetamines. Thank you.